You're watching KPVI News at 10. News that works for you.
Good evening and thanks for watching tonight. I'm Matt Davenport.
And I'm Marlise Thurby. The first vaccine was created in the 1700s for smallpox, and the mid-20th century saw the creation of vaccines for polio, measles, mumps, and rubella.
These vaccines used to be seen as a miracle, but in places like Idaho, suspicion of these medications are at an all-time high.
KPVI News that works for you reporter Rachel Cox-Rosen is in the newsroom to explain.
Thank you. A recent study shows more and more Idahoans are choosing to opt their children out of vaccines, leaving doctors terrified.
Vaccines, which stimulate the formation of antibodies.
Vaccines are safe and effective and the most powerful public health tool that we have.
Dr. Barker's view represents much of the medical community, but many Idahoans disagree.
You can see here less than 80%.
Idaho Health and Welfare tracks vaccination rates in Idaho. Based on 2017-2018 numbers, 31 out of 44 counties in Idaho are vaccinated under 90%, the minimum for what doctors call herd immunity.
We think for the best protection for the entire group of children, about 90% of them should be vaccinated to keep that any possible measles case from spreading within a school or another setting.
Idaho is one of 18 states in the country that allows non-medical exemptions from vaccines, including for religious and philosophical reasons. This means parents can enroll their child in any school or daycare without the proper vaccines, and they can do it for any reason. A recent study says Idaho has 8 of the 10 counties with the highest exemption rates in the country. For example, health and welfare numbers show 22% of Bonner County students were exempted for non-medical reasons.
That population of people, that community in and of itself, is vulnerable to an outbreak. If measles walks into that county, even though there's only 1,000 people, their herd immunity is low, they're very vulnerable to a measles outbreak.
To exempt your child, all you have to do is fill out one of these forms, and Idaho law says it doesn't require a doctor's signature.
I'm less focused on changing law to try to force something. I'm more about educating, doing everything we can to really show parents that we think that this is really the best thing for their child.
Dr. Hahn says the legislature has not expressed interest in changing exemption policy. The only bill related to exemptions moving through the Senate is Bill 1227, which would allow parents to exempt from vaccines with as little as a signed letter.
I think we are going to have to see some sort of more significant outbreak to improve those laws.
And she thinks that sort of outbreak could happen at any time.
That's the scary thing. I'm just waiting for it to happen because we have big enough pockets that if the right person walks in, it'll be a big rapid spread.
Coming up tomorrow, I'll dive deeper into why people are hesitant about vaccines and what Idaho doctors are trying to do about it. Reporting from the newsroom, I'm Rachel Cox-Rosen. Back to you guys.